and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad, we
Bob.
just did a video on how the top 3 signs that your back pain is actually coming from Facet Joint Syndrome. And now we're going to show you, if that is the case and you are getting pain from that, how to do exercises for it.
Right.
So we're going to start off with first kind of some warm-up exercises. Brad, do you want to lay down flat first?
Right.
I got your belt. Don't worry, Brad. You looked really upset that I took it.
That's exactly right.
All right, we're moving the joints in the back, and one simple way to do that, you're actually moving your hip with this one too, but one way to do this is just to warm up your back by gently rotating your hips back and forth.
And I want to point out on this, Bob, is it works better, I find with my patients, I say bring your knees gently together and your feet gently together, because if you have a space between, it just doesn't work so good.
Good cue.
Keep them together.
Yep, and this is a good one for no matter what back pain you have. A lot of times this is a great one to do before you get out of bed in the morning. So, do you want to do the other ones too, Brad?
Well, sure, Bob.
Why don't you flip over onto your stomach or your knees, hands and knees, and do cat camel.
Oh, yeah. Okay.
So again, just to kind of warming the joints up here. So he's arching up this way, making kind of a hump. I guess that's the camel.
I'm always be confused about
I do too. I don't know which one's a cat. I don't know which one's a camel. Because then you're arching this way. So, I mean, I guess a camel would do that, but a cat would do this.
I don't have a cat, Bob.
Either way, so he's making a hump this way, and then he's arching the other way.
There you go.
Again, great way for working all those facet joints, or facet joints, as they say in Australia.
Which there's nothing wrong with that, Bob.
No, there's nothing wrong with that.
Okay, next.
The last one is a downward dog, where you actually put your legs, knees way apart.
Oh, that's right.
Way apart, wider than the shoulders. And then you're just going to lean back, and yep, pressure on, pressure off. Pressure on, pressure off.
And I did want to make one point about this, Bob. If you notice, my feet are off the end of the table. It's a lot more comfortable for a lot of people. So you can't do it on you can't do that part on your floor. If you go in your bed and leave your feet hang off the edge of the bed, if you got a relatively firm bed, that might help comfort with this particular exercise.
Young people can probably do it on the
Oh
floor.
yeah, young kids, but they usually don't have this problem, Bob.
All right, now we're going to get to some more advanced ones. And what you're going to look for is, let's say you're having, again, facet joint pain tends to be kind of pinpoint pain, really localized. If you bend forward and you have the pain, you're going to do this one. If you do bend back and you have the pain, you're going to do it this way.
Right.
So let's go ahead and describe those, Brad. You need a belt.
All right.
There we go.
All right. So you're going to put the belt where it makes it feel the best.
Right.
And only you are going to know that. No one can really tell you.
And you're going to have to experiment to figure that out. First thing I want to show is his arms are at a right angle here, the elbow is,
Right.
okay?
Not like this.
So you
not
start
like
with
this.
that, and you're grabbing on, and then you're going to pull up to the chest.
You can see the belt dig in.
Yep, look at his hands should almost come up to the chest and really up like this, and even touching the chest, Brad.
Well, how do you keep your elbows at 90 degrees then?
You don't then. At that point, you start with your elbows at 90, then you're going up like
Well, there's
this.
going to be people that are keen on this.
Yeah, good point then. So when you put the pressure on, Brad, and if your pain is when you go forward, then you want to go ahead and lean forward and come back.
Now, another thing people are going to say, you said if we lean forward, it's not facet joint problem.
Well, we're loosening up the joint.
Oh, okay.
This is all we're trying to do is
All
we're
right.
breaking those joints up so they're moving.
So if I go forward and I do this, and that should
What you
make
do,
it feel better,
pressure
right?
first, and now while you're doing the pressure, go forward.
Okay, yes, there we go, Bob.
If
Thank
that
you.
makes it worse or it's really sharp, move the belt up or move the belt down.
So we're going to start out low. If I bend forward, it's not helping. I'm going to go up a little bit, pull up, and bend forward. Oh,
Right.
that's better. And you'll get that result.
You'll find the right level. For going back, I guess again, you want to just do it, Brad?
Sure.
Same thing. If you find that the pain's going back, again, put the pressure on. Pressure needs to be on place before you move, and then go back. Oh, that hurts? Try a different level.
Going to move it up a little bit. Oh, yeah, that's better there.
Now, the alternative to that is if you have good flexibility, you can take your hand and you make a fist like this. And the pressure is going to be right on the thumb here, is where I'm going to put it. So I'm going to put that back here like this. And I'm just going to use my hand, Brad.
Okay.
And what's nice about this is you can sometimes go off to the side of the spine. Here's my spine right here.
Right.
I can go off to the side that it hurts on.
In that muscly area.
Yep, and I'm pushing up this way.
Sure.
That's why you need to have good flexibility to do this. I'm pushing up, and then once I push it, now I bend forward.
Sure.
Or I might go on this side, press up. And I'm using my other hand as a lever to help push
Right,
it, give it
push
more
it up,
pressure.
right.
So I'm using both hands to push up. You can go right in the center too if you want. You can push right there on the center. If your pain's going back, you can go ahead and go back. Well, my back just cracked.
There you go.
So you can work your way up the spine.
You're going to know you're in the right location because when you do the technique, it improves the pain.
Right.
It feels better. If it makes it worse, you're in the wrong
Absolutely do not do it.
Right.
If it hurts where you're pushing, you don't do it. I mean, it's as simple as that.
And we should probably mention the belt technique and the fist technique come from
Mulligan,
Brian Mulligan.
Brian Mulligan,
And where's he from?
New Zealand.
And I think we both saw him live.
Yes,
at
we
it,
did.
And
He's
I'm pretty
quite a character.
Yeah, he is. I'm pretty sure he says facets
He probably does say
and
facets.
cervical.
Cervical.
Yeah, so we're probably going to get some comments from that part of the world.
He's very talented. He's quite a character.
Yeah,
That's all I can
he
say
is
about him. So.
he is a true health.
All right, if you haven't already, make
health
sure you
person.
subscribe. I'll put it somewhere over here.
Yeah, right up there. Okay,
Okay,
thank you.
thanks.
Thanks for watching and all that stuff.